I'm Rob Boyd. I'm the Oasis Program Director at Sandy Hill Community Health Center, and we're here today to talk about the carfentanil detection that we had in our center yesterday, which prompted us to issue an advisory to the community. So the drug carfentanil, this is a drug that's not intended for human consumption. It's the most toxic fentanyl analog that we know of. It's an animal tranquilizer, and so when this is present in the drug supply, we believe that there's an elevated risk of opioid overdose. I think that most people are aware of the drug's existence and the fact that it is something that may occasionally be in the drug supply, but really without being able to have point of care drug checking for people, there's actually no other way for them to know that. You can't smell it, you can't taste it. The only way that you would know it was there is if you took it and you overdosed. So the instrument that we have, it's a mass spectrometer, so this is the gold standard for drug checking, and it is a portable one. Most mass spectrometers are quite large, but we needed something that was going to be suitable within the consumption room environment, and we also wanted something that was going to be able to provide results relatively quickly to people, so within 2 to 5 minutes, and ideally we'd be providing people with the results prior to the use of the drug. So this is the one that we've chosen to use, and it has demonstrated quite a good sensitivity. There are 18 different substances currently that we are checking regularly on this, and carfentanil is one of them. You know, it gives people an opportunity to get information that they don't otherwise have and to protect themselves. I mean, there's a very common belief that people who use drugs are not interested in their health, or that they don't really care about what happens to them. You know, we know that they do. We see that every day here, that people are doing their best to protect themselves, but we don't give them enough information. When they have to go to an unregulated market where there's no way of guarantee of what it is that they're purchasing, they're very vulnerable to that. So to be able to provide them with the opportunity to test the samples, you know, really kind of sends another message about A, we care, and B, that we know that given the right information, that you're going to make wise decisions for your health. The other advantage that we have with this technology is that we do send the results of our drug checking out to the larger community. There are a lot of people who would never come down to use a service like this, but they also, it's important that they understand what may be in the drug supply that they're using. So we're thinking about the recreational drug users, including stimulants like cocaine or amphetamines. If you're buying from the unregulated market, it's important to be aware that it's quite possible that the supply may contain some fentanyl analogues, including carfentanil as well. So we ask people to take the necessary precautions, which would be not to use alone, make sure that there's naloxone available and somebody to call 911, not to mix their drugs. And if they can, if at all possible, try to get your drugs checked prior to use.